My name's Diane, and I'm a very, very happy user of my carpal tunnel. How do you say it? My carpal solution? The rubber thingies. I'm a music director and accompanist in Los Angeles. I've worked here for 30 years. I do everything from blues to classical to opera, chamber music, musical theater, as well as my own compositions. I have 3 albums out of my own. And I wouldn't be able to continue working as a musician without the carpal solution. It's completely changed my life. I tried everything out there. I made myself a list because I can't remember all of what I tried. Every brace on the market, every cream, dozens of doctors, physical therapy a few times, once with a hand specialist who actually re-injured me, giving me inappropriate exercises. I had one physical therapist that made a mummy type brace for me from the hand all the way up to the shoulder. I had to sleep with every night so that I wouldn't bend my wrist or my elbow. I found that with all the braces, my muscles just atrophied and things got worse, and the pain got worse, and the function got worse. I got to where I did tons of acupuncture. I even ended up, with chiropractic. I went every route, and I had a million very painful nerve conduction studies. I ended up at USC with a hand specialist, one of the top hand specialists in the country, who said, within 5 minutes of looking at my nerve conduction studies, you have to have hand surgery. And by the way, I do this all the time. Concert pianists, here, I have their phone numbers, call them. We're just going to reroute your ulnar nerve. You're going to take the nerve out and put it on the outside of the elbow where it's not at all protected. And by the way, we'll just get those carpal tunnels out of the way like that at the same time. So I knew better. My father had had a carpal tunnel surgery on both wrists. And I would ask him repeatedly at different intervals after his surgery, well, are you feeling any improvement? And he said, no. That was after 6 weeks, 6 months, 6 years, 16 years. He might as well not have done it. And he had reduced function in his hands as well. And he still had pain. So I was kind of out of options. And I kept, from time to time, looking around on the internet. I mean, things had gotten so bad that I was dropping things. I couldn't button my clothes. I was very clumsy. I was telling you guys earlier, like I couldn't play something like this. I didn't have the articulation, the facility, or the control. My fingers were just, I felt like clumsy all the time, so it would come out mushed, I couldn't articulate in there. And of course this affected my work. Needless to say, I couldn't work for a while. I couldn't even turn on the hand signaler on my car. It was just too painful. Driving made it worse, working on the computer made it worse, playing piano or electric bass, which I also used to tour extensively doing, made it worse. So I was kind of between a rock and a hard place. And about that time, surfing the internet, I came across, totally by fluky chance, mycarpaltunnel.com, because I was hoping, well, there's more treatments maybe that have come out or whatever. And it looked pretty strange to me. I mean, there's this tapey thing you put on, you just wear it in your sleep, and the claims were like cure, and I'm going, yeah. But then I saw that it was developed by a physician. So I started taking a closer look at it, and to the point where I looked at the price, and it was pretty impressive, how cheap it was relative to the thousands of dollars I'd spent to get worse. And so I tried it out. And for 6 weeks, I wore it every single night like they recommend, and I noticed a definite improvement. My case was a little intractable. I mean, I'd spent 20 years with this problem, so I think I probably took a little longer than the average bear, but my improvement was steady. So after 6 weeks, I was able to taper off and not use it every night. But I used it for the next 6 months, at least 3 nights a week. And then after that, all this time, remember, I'm resuming function and I'm working harder. So I'm playing more and more and more. I mean, when you sit 12 hours a day, you don't realize, wow, I couldn't do that last year. You know what I mean? So At this point, and I've been using them 3 years now, plus, the insurance pays for it, so it's virtually free. It's been literally the difference between me working and me not working. And for a musician, that's more than just money. That's your life. That's who you are, and that's what you've invested everything in. So now I'm at the point, I did a chamber music workshop last summer. I couldn't have done without this, because I just wouldn't have had the facility or the stamina. The pain, I couldn't sleep when I had that pain. And so if I have a heavy day of playing, like a 12-hour day, I will still use them at night, just to make sure I don't have pain in the morning, But the fact that it's not only helped the symptoms, but it's allowed me to go beyond where I was, because now I can approach more challenging material. It's been a miracle to me, it really has. So I'm very, very grateful. Thank you. I talked to Karen for a long time because I was still skeptical. And she explained to me that the way that this works, which of course I had to know, is that, well, maybe let me show you. This is just for the right hand. When you get these things in the mail, you get, I love this because I'm kind of retarded sometimes. They have the right hand ones for the right hand, and then for the left ones they have a picture of the left hand, so that's easy to figure out for me. You pull these things out, they come in clumps. You got to declump them, which just means pulling them apart. This one's for the right hand. So this is just paper and adhesive. The middle part's like a real light rubber, and they tell you how to do this. You're going to look to see that this circle in the middle becomes an ellipsis. So I asked her how this worked. So let me put this on here so I can tell you what she said. So I just put it like that, pull back this tab, boom, take that off to fit. Same thing on this side. The hardest part is throwing away your trash. And then this comes around here. So you can see, first of all, it's really easy to customize it to your own hand. But you've got tape, here's your rubber thingy, and you got tape coming on here, here, and here. And what this does, and what she explained to me, is it very gently stretches here, here, and here in order to open the blood flow to the carpal tunnel itself. So whenever anything gets more blood flow, it means it gets more nutrients. That means the body can heal itself. So what I noticed almost immediately was the swelling that I had here in my wrist went down. This is really comfortable. I mean, you don't even gonna know you have it on. In the morning, by the way, I have a special release technique. You just take this tab, boom, you're gone. Now, remember that during that whole time, I'm still working, I'm still playing, and as I get better, I'm playing more because I can, because I had to cut back a lot. So I swear by this. I want you to know I've never done a testimonial before, and I would have poo-pooed anybody who came to me for one. And that's largely because nothing ever really worked for me before. But I was really happy to do this, and I will do anything I can for this company because they're the difference between me having a career and working and being able to do what I love. And that's of inestimable value. And I tell people, I went to the post office the other day, and the gal at the clerk had, the braces on, and I'm sitting there remembering that nightmare and how that just made me worse. And I just mentioned to her, something I have, that will help someone not suffer the way I've suffered. I'm going to tell them about it. So I said, do you have carpal tunnels? And she said, yeah. And I said, I used to too. And right there, most people can't say I used to. And I said, just check out this website. Because why would I want anybody to suffer, if they don't have to? And it's that simple. It's one of these things that everybody said would be too good to be true. It is good and it is true. That fear has been replaced by hope and joy in being able to return to what I love to do. And know that I'm for real. Thanks a bunch. Help yourself.